into texting. I'm not saying just texting with those people who are driving, texting while driving, but there's a recent article, it was AHA or a local newspaper, about the number of hospital emergency room admissions of people who are texting while actually walking.
It's certainly in the area of distracted driving. It is something that people are starting to raise, and it's starting to emerge as one of the issues related to distracted driving. One of the interesting things about the texting while driving is that it looks like some of the laws may not be as effective as people had thought they would be, and it's not clear why that is. Some people have hypothesized it's because instead of holding the phone up like this, somebody's like this, and so they're no longer looking up, and because they don't want a police officer to see them texting. But we certainly do look at risk factors, and so if that was a risk, if that's a risk factor for falling, we would look at that as a risk factor.
Just commenting on the texting one, it could be that it wasn't as effective because it wasn't implemented with an educational program as well. It could help when these laws are passed in states that not only are they passed, but you let people know that they're passed. So in Maryland, it wasn't passed, and there was a very limited educational, advertising program that went along with it.
It's one of the areas where we're not sure whether actually the policy is ahead of the science, which sometimes happens, so that we're not really sure that something like that will make a difference in people texting or not. So education certainly is important, but it's not the only way to, it's not the only thing, so we need to know whether these kinds of interventions will make a difference.